Welcome back to Sage Connections. Today, we're diving into one of the most important seasons in a woman's life: pregnancy, birth, and postpartum recovery. I'm joined by Marie Wall, an experienced midwife who has dedicated her career to supporting women through these transformative stages. Together, we'll explore how midwifery and pelvic floor physical therapy work hand in hand to prepare women for labor, guide them through delivery, and support true healing in the months that follow. Whether you're expecting, planning for the future, or supporting someone you love, this conversation will give you insight and encouragement for the journey ahead. Enjoy. Can you share a little bit about what led you to become a midwife and how you see your role in supporting women through pregnancy and birth?
Sure. Yeah. So, a background of myself is I was an ER nurse in a Detroit hospital for 8.5 years. Um, and I was actually on the track to be either a nurse practitioner or a certified nurse anesthetist, and never really showed interest in women's health, to be quite honest. And there was a season of my life where I felt like everything was leading towards women's health. And kind of the defining moment was it was a very busy night in our ER. We had multiple traumas come in that night, and I was on my way leaving, and one of the security officers said, "We really need somebody up at the front walk-in entrance." And as I was walking up there, I was kind of just irritated that I was even being called later than I normally need to stay. And to my surprise, there was this woman that was giving birth in her car, and I go to turn around to tell one of the docs, "Hey, we're having a delivery," and it was just me. And it was pouring rain, and honestly it was kind of like in a way it was like a movie. And I turn around and I'm like, oh my gosh, it's just me. Okay. And I'm in pouring rain, and this woman spoke no English and I did not speak Spanish, but here we were in this really sacred moment of her life. And she had 4 children in the back seat and her husband in the driver's seat, and we just had this baby. And at that moment, I really do believe that that was that defining moment. A peace came over me that really made me explore other avenues of advanced practice nursing, and nurse midwifery was one of them. And I did shadow one of my friends who was a nurse anesthetist, and I was like, this is the most non-appealing job for me. And I shadowed one of my sister's friends who was a nurse midwife at a local practice, and I was like, this is it. And 12 years later, here we are.
Amazing. Wow,
So
what a
yeah,
story. Especially for
yeah,
your first experience in that world. Why, I mean, that's it. It's
yeah.
it's it's
I mean, it's
exciting.
as physiological as it comes, a
Yeah.
birth right there.
Yeah,
Yeah,
yeah, absolutely. So,
yes,
what are some common challenges that you see
yeah.
pregnant women face, and how do you help prepare them for labor and delivery?
Yeah. So I feel like a lot of the common challenges is our normal discomforts of pregnancy: sciatica, back pain, round ligament pain, pelvic separation, our headaches, um, the moods, the emotions that all come in with pregnancy. And I feel like just a lot of reassurance. I mean, yesterday I was in the clinic, and I was like, that was our theme, a lot of reassurance that this is okay, you're experiencing this, but let's navigate natural ways, let's navigate how we can overcome some of these discomforts to make them less concerning, less discomforting. And a lot of the things that we do and educate on of is stretches, and your physical therapy and yoga, and getting on the ball, staying active. I don't think women realize that in pregnancy, staying active is super helpful and beneficial. And that, the more we stay active, not always is it going to be, to the extreme that maybe you did prior to pregnancy, but staying active is so helpful, just keeping our body ready for labor and delivery of
Yeah,
your baby.
absolutely. Research shows that staying active, even lifting to some extent,
Yeah.
is very helpful, not just for the mother, in terms of
Mhm.
preparing her for labor and delivery, but also for the health of the baby throughout the
Mhm.
pregnancy. So there
Exactly.
really isn't any contraindication aside from, something crazy like running a marathon or lifting very excessive weights. Although I have seen a woman when I worked in Chicago who ran the Chicago marathon
Mhm.
like at like 38 weeks or something like that,
Yes,
which
absolutely.
yeah. But so with that being said,
Mhm.
I guess from your perspective, we work together as a pelvic floor physical
Yes.
therapist.
Yes.
And what do you think from your perspective, like how does pelvic floor physical therapy fit into pregnancy care? And
Mhm.
what results
Mhm.
have you seen for people that have had it and those that haven't gone through it?
Yeah. So, I mean, really, pelvic floor is just so amazing just to learn how those muscles of your pelvic floor work for pushing a baby out, right? Like, I mean, it really works together. And also, not only that, I mean, a lot of women start noticing earlier on that, especially if it's not your first baby, that man, I just sneezed, Marie, and now I'm leaking on myself. And so just that re-strengthening early on to prevent any big potential, you know, effects after delivery. So I feel like that is super, super helpful in just preparing for childbirth.
Yeah, to your point, I mean, there's a lot of women that come through my office pregnant, usually with their
Mhm.
first, but sometimes after
Yeah,
multiple births, who really
sure.
don't know how to coordinate their pelvic floor for the pushing
Mhm.
phase of labor and delivery. And so that's a really big piece that we touch on, and I train them to understand what that means. So when you're there and someone is saying push, you know what that means in your body. And I've had so many patients come back saying like this delivery was so much easier than the first because I actually knew what I was supposed to be doing.
You're
Um,
using the right pelvic floor muscles,
that's
right?
right. That's right. Yeah, it's like somebody, saying that you have to run and you've never run before. You're just practicing to run and move your muscles and strengthen your muscles in those ways to help you do a specific function. So
Correct.
awesome.
Yes.
So, how do you
Yes.
think, well, we kind of touched on this a little bit, but
Yeah.
how do we work more together as a pelvic floor PT and a midwife to get, I mean, I think a big part of it is just communicating, like you and I communicating.
That's exactly it.
Yeah.
Yes.
Do you have anything else to add to that?
No, I just think, I think the communication piece of now when you're in a health system and you refer internally, you usually are getting the plans of, we're progressing, here's the exercises we're doing. When it's external, it's a little harder. So it's really important to also the provider and the pelvic floor therapist to be like, just let your provider know that X, Y, and Z is taking place. Here's how we're progressing. Here's things that we can work on more at home. But I really just think just the communication piece between all three, because we are a team, including the mom. She's a huge part of our team, you know.
Absolutely. Yeah. And I think, what I really love about sending people to your practice or when I work with people that come to me from your practice is that your practice is very open to non-traditional. I guess I say
It is.
non-traditional because not every hospital does this, but they should, anything from moving during labor. That's a
Yes.
really big thing because I've had a lot of patients come
Huge.
in that say, I just laid on my back for 4 hours
Mhm.
and or
Mhm.
they just tried to induce me and I wasn't sure why. So can you
For
kind of
sure.
describe a little bit about how you guys practice maybe differently? I don't know if you feel like you do it differently. I
Yeah.
sure do, but
Sure. Yeah. So I'm at Henry Ford West Bloomfield. I am one of the staff midwives there. We're a practice of 20 now, which is just that speaks volumes alone. But yes, I feel like we are very um, we can meet you where you are. If you are completely uncomplicated and you want an unmedicated birth, we have tubs, and we have our aromatherapy options, and we have the birthing balls and the peanut balls and squat bars, which I feel like is so helpful for so many women, even if you don't want that unmedicated birth. So I feel like that we have a very holistic approach in that regards. But then when we have our women that come in that are co-managed with our physician team, that are a little bit higher risk, that need that continuous monitoring, that might need that induction, we really can meet you to keep it as holistic as possible. But then we need our medical approach, right? So our monitoring system is wireless, meaning you're not connected to the bed, where a lot of hospitals, they have you connected to the monitor on, where you have like a 10-foot area where you can move. But ours, you can get up, you can walk the halls. Even we're going to continue to monitor you that way. And if we do need a little bit more of the medical approach, we have that option, and a safe option to do that. And then when you're in, we're doing our every 4 weeks, every 2 weeks, prenatal visits. We have amazing resources. We have in functional medicine that a lot of our patients utilize. And Henry Ford is amazing for supporting them. We have chiropractors within our health system as well. We have massage therapists that in our health system, and they're all employed through Henry Ford. So I think that is what kind of makes us a little bit different and stand out, is we have a lot of options that you don't have to externally find your own resources for.
Yeah. And I also feel a lot of the feedback that I get is that patients are actually feel like they're listened to when they go to your
Mm-hmm.
practice.
Mm-hmm.
And, whether they choose to go with a doula, so
Yeah,
which is
that's, yeah.
for all intents and purposes an advocate for the patient in that
Mm-hmm.
in that situation. So whether they come with their own doula, but even if they don't, they just feel heard. They're not pushed into anything. It's just if they have a plan and you guys do your best to stick to that plan as much as, sort of safety allows. And I think that's why so many people have such positive experiences at your hospital and at your practice.
I agree. I really agree with that. And I will say, Henry Ford, within the last about year, actually started their own hospital-based doula program. Now, right now, there are some fine guidelines of criteria that you would meet, being eligible for one of the hospital-based doulas. But that is also another option that was actually started by one of our maternal fetal medicine, which is a high-risk doctor. She was the one that really developed and worked on getting this program up and running. So it comes down from our super high risk doctors all the way down to the midwives, that we really are a very integrated team to work together for the benefit of patients and their families.
Very cool. So,
Yeah.
what do you think some of the biggest misconceptions are about, look, first and foremost, labor and delivery for
Yeah.
patients that have never, experienced that, and then postpartum recovery?
Yeah. My first time mamas that are delivering, and I say this, so we're gearing up to pushing now. This sometimes is the marathon part. What do you mean? I'm like, yep, this is not the movies. This takes a lot of work. Your body has never, physiologically pushed out a child. So you and your body are going to be really working together. So the biggest misconception that I find, almost especially with first time moms, is this is not the movies where your water breaks and you have a baby, or you're complete and pushing and 5 minutes later your baby is out. Sometimes it works like that, but a lot of times that is not reality, even for us second, third, so on moms. Sometimes the pushing is the hardest part. And so listening to your body is so important during labor, but really during the delivery portion. Another, I think, very big misconception is that no pregnancy, no delivery is the same as your best friend, or as my first delivery and pregnancy, or as my cousin or my mom or my aunt. Your story is your story. And so know that it's great to listen to advice, but we have to be very careful because sometimes that will put really bad misconceptions in our head that can really inhibit our body doing what it's meant to do.
Yeah,
Um,
I agree. I've never
yeah,
heard the same story twice.
never. I have three different birth stories myself.
Yeah,
So,
yeah.
um, and they're all amazing, but they're different, right? And
Mhm.
that shows you that, it's okay. It is okay. And don't go in thinking, well, I delivered my first baby at 39 weeks. I must going to deliver the next one at 39 or sooner. Because no,
Mhm.
that doesn't work like that. Or my mom, she had C-sections with all of us. So I'm just anticipating that that's how my delivery is going to go, where it's like, no, that's sometimes, yes, it does follow, but a lot of times, no, you're making your own story. So
Right.
that is a big misconception for pregnancy and delivery. Postpartum, I feel like so many women feel like within a couple days or weeks, they need to be back to what they were. And no, don't put that in your head because your body has gone through so much change in 9 months. You think that it's going to go back to normal in a couple days. No, allow your body to heal, allow people to take care of you. You are undergoing your own healing process, and it is okay whether it does really sometimes take a couple days, but sometimes it's a journey of months to get back to what you were before.
Absolutely. No, I totally agree. I mean, the research
Yeah.
even shows that, for example, something like diastasis recti, we have about 14 months before, in order to close that gap.
Yeah.
So things like that. I mean, think about any other surgery. If you had ACL surgery, it
Right.
takes 6 to 9 months to become fully functional after that.
Hmm.
When I mean, here you're delivering a baby that
Hmm.
you've grown for,
Yes.
40-ish weeks,
Yeah.
and your body changes, your posture changes,
Hmm.
um, your rib cage changes, everything in your body changes to accommodate that baby, and then we just expect to bounce back. I mean, there's such a culture of perfection around
Yes.
that, and I
Yeah.
think it gives people a lot of shame, maybe, and worry if they're not back in the 6 weeks or something like that.
Correct. Exactly.
I've seen people who are runners who run in 6 weeks, but I've also seen people take a year or 2 years to get back to their prior level of function. And it's
Yes.
all okay.
And that's what we need to reassure our women and validate. Your journey is your journey. Move forward every day. You've done something, right? Like,
Yeah.
especially some women really deal with mental health, and we need to be mindful that if your mental health isn't at 100%, your body is also not going to be at 100%. Your healing is going to be delayed. And so we need to touch base on the whole, not just, well, physically, how are you feeling? No, it is a physical, mental, emotional, and spiritual healing all in one. And if one is affected, it is going to delay our healing in general.
And on top of that, sleep is also
Oh
interrupted.
my goodness. Sleep is the biggest. Yeah.
Yeah, and we as animals, as humans, need
Yes.
sleep to function properly.
Right.
And
That's right.
when we when our sleep is impeded, and then on top of that, we're trying to take care of this new little dependent thing on us.
Yeah.
Um,
Yeah.
and on top of that, the feeding and lactation, which is a whole other podcast. But there is a lot going on, and I think if nothing else, I hope that women take away the fact that they have to be kind to themselves. This is a very
100%.
new way of actually delivering babies. in
Yeah.
in our past, it's been kind of a village project, right? Like you have your mom there, and your grandma, and your aunts, and your cousins, and your siblings, and And as a little child, you're aware of birth and you kind of know what to expect and you see it and you participate in it. So when it's your
Right.
turn, you understand it better. Now, because it's, we live further away from each other,
Mhm.
it's, a different kind of society, a different kind of
Yeah.
family structure. Um, Now it's more hospital based and you sort of have to recruit out your help with whether it's PT or doula or midwife or whatever it is.
Yes, yes.
And so there's a lot more mystery now
Mhm.
when it comes
Yeah.
to labor and delivery, where I think for most of our existence, it's been less so.
Correct. Yeah. And, I always love when I get certain cultures come through and they are still that very tight knit family unit. They take care of the mamas during labor, during delivery. And then, when they come and see me, okay, how's everything going? Great. I haven't lifted a finger. My mother is still here. Or my mother in law is still here. And, and they take care of them. And I wish we had more of that culture because I think it would really help so many of us get through this postpartum period a little bit more with ease.
Yeah,
Yeah.
absolutely.
Yeah.
So, how would you approach empowering women to advocate for themselves in pregnancy, childbirth, and postpartum?
Yeah. I think the big thing is knowing that you are the key component of your health. And if you have a good relationship with your provider, which is so important, whether it be a physician, whether it be a midwife, whether it be a nurse practitioner, whatever it is, that you advocate for yourself, you speak up, you do your own research, and don't be afraid to say, "Hey, I don't like that. I'm not comfortable with this plan. Can you explain what is the rationale of why you're recommending a 39-week induction, or what is the rationale of this extra ultrasound?" It is okay to not just go along with what your provider says. It is so not okay, actually. And you
Mhm.
really need to question, because sometimes if you question and say, "But why that extra ultrasound?" and we don't know, well, then we need to know, because maybe it is not indicated and maybe it was just routine because it's what we've done for X amount of years, or maybe there is a medical reason why we do recommend this ultrasound, and then we can explain that. So I think really women being empowered is by being a part of your care and speaking up and asking questions and listening also, to your body and to what everybody is kind of in your care team telling you, and have a care team, feel that it is okay.
Yeah, and I think, the thing that we're blessed with as women is a strong sense of intuition.
Yes.
And
Yes.
we can't let that go. We have to listen to it.
Mhm.
Uh,
Exactly.
so so especially as, being a mom,
Yes.
I think maybe it's ramped up even more. So yeah, if something doesn't feel good or comfortable or you have questions, advocate for yourself, ask those questions,
Exactly.
or find somebody that you trust to advocate for you. Um, so
Exactly. I really, and I will say, we are really good in our practice about patient-centered care. Like, you are the piece that we need. Yes, we will guide you. Yes, we will educate you. But at the end of the day, we want you to make the decisions that you feel best after being properly informed of risk, benefits, indications, but be involved in your care. It is so important for great, wonderful outcomes.
yeah, I always like to say I'm just the co-pilot here.
Yeah,
I'm
exactly.
just, yeah, I'm helping, but
Yes,
yeah.
exactly.
So
Exactly.
finally, is there any advice, any final piece of information that you'd love to give our listeners who are
Sure.
pregnant, who want to get pregnant, who are starting this journey or in the middle of it?
Trust your body to know that it knows exactly the proper timing and what it is doing. And the other thing is we don't need to check every box. If it doesn't apply to you, don't check it off, because this is what the internet says, or this is what mom says, or this is what so and so says. Your journey is your journey. Enjoy it. The good, the bad, the ugly, the beautiful. Take it all in and know that you are able and capable of doing this and doing it well.
Thank you.
Yeah.
Perfect.
Yeah.
Thank you
Yeah.
so much. And we'll
Yes.
talk again soon. Thank you so much to Marie Wall for joining me and sharing her wisdom and perspective. I hope today's conversation inspires every woman listening to feel more supported and confident as they move through pregnancy, birth, and beyond. As always, thank you for tuning in to Sage Connections. If you enjoyed today's episode, please subscribe, share it with a friend, and leave a review. It helps us grow this community and reach more people with these important conversations. As always, take care of your health and your wellness.